So we reviewed a whole wide range of data sources, and we looked at a lot of different perspectives and point of view around the quality of life in Maryland. And we're going to share that our conclusion that basically the quality of life in Maryland depends on who you are. And while Maryland is leading in many national indicators and very important ones, we are leaving too many people behind and too many people out of what we would like to call the Maryland dream. So we're going to share with you areas where Maryland is doing well and areas where we really need to improve. We're going to talk about what a vision for a better quality of life for Maryland could look like that was developed with the help of many of you, and then what it will take to get us there, using some real-life examples from nonprofits taking a leadership role with business and government to play a transformative role in their communities. I'm going to conclude with a call to action to all of us for how we can change our work in our home institutions and how we can take this charge to our policymakers in Annapolis to create a policy environment that creates a quality of life that's going to make a difference for every single Marylander. So when we say that the state of Maryland's quality of life depends on who you are, what we're talking about is far too many people are left behind. So this is actually the richest state in the nation, as measured by median household income. It's the highest. And this is arguably the richest nation in the world. So if we can't have prosperity for every Maryland community here, where could that kind of prosperity be possible? Maryland is number 4 in education nationally. That slipped actually from last year. We were number 3, but it's up there. We're number 2 in generosity. Yay, nonprofit sector, yay, donors. We're doing well there. We're number 1 in professional and technical workforce readiness. We are number 2 in healthcare access. We're number 3, I think, in support for number 2 in support for businesses, and we're number 3 in minority business ownership. So there are definitely ways that we're doing better than most countries in the nation. But we're here to say better isn't good enough when too many people are left behind from that equation. What does it mean to be number 4 in education when the educational outcomes in Baltimore City are among the lowest in the entire country compared to other urban areas? We have African American unemployment is the highest in every county in the state. African American median income is $20,000 lower than the average median income. We have record high levels of inequality, and in some neighborhoods, child poverty and high incarceration rates have never been higher. So we really have a lot of challenges to address. And this is not just talking about our urban areas and issues in Baltimore City. The poorest areas of our state, many of them are in the Lower Eastern Shore and in Western Maryland. And in fact, recently, a report that was given to the, excuse me, I wasn't out networking this morning because I was eating honey, nursing my voice here. Moody's Analytics provided a report to the Augustine Commission earlier, where they actually put in black and white, with the exception of Western Maryland, Baltimore City, and the Eastern Shore, Maryland's quality of life is quite high. Okay. So we're here to say that we're not okay with that. We're not okay with being the richest state in the nation and having these huge exceptions, these huge carve-outs, for that some people can have a great quality of life and some people are left out of opportunity. What we'd like to promote is a triple bottom line, where our economic growth and development is interrelated with our environmental sustainability and our community well-being. When we grow our economy, we need to make sure we're doing it in a way that is helping our community be strong and having a healthy environment. So when we think about what kind of quality of life we want to have, we actually asked all of you for your input on this. And we want a quality of life where Maryland's communities are connected to each other, that there is peace and justice and equity in our communities, where people have access to excellent educational opportunities all across the lifespan, good paying jobs, thriving businesses, and places where people can get from point A to point B on public transit that really works for everyone. People want to live in communities where they have access to the arts and recreational opportunities and ways to keep their bodies healthy. People want their bodies to be healthy in a healthy environment. That means they have clean water to drink and clean air to breathe. That is driven by renewable energy sources and access to fresh, local, nutritional food. People want to have healthy relationships in their communities, both on the physical, on the social, and on a spiritual plane. But too many communities are too far from this vision. If we think about our inefficient transportation system, we actually have 50% of people spending more than an hour in the car to get to work every day. I bet many of those 50% are in this room. It took you even longer to get here today. And it's 90 minutes to get to work on public transportation for more than half of the people. So that is really not okay. Because when people can't get to their jobs in a timely manner, they don't have time to cook a healthy dinner. They don't have time to go exercise. They don't have time to help the kids with their homework. They don't have time for their own mental health. So this really has a tremendous impact on our quality of life. And I'd like to just look a little bit further at this. This map done by the Maryland Center for Smart Growth shows that with our current transit options, things aren't getting any better. Look at what this is projected to look like by 2030. They actually, do that again. They actually call this the heart attack map. Doesn't that look like that? So literally, the kind of stress that you get when you're sitting in traffic can kill you. And that is one of the factors that is driving so many chronic diseases in Maryland. So we are having really horrible health outcomes when it comes to heart disease, diabetes, and other preventable chronic diseases. And one that I would like to spend a little time talking about is asthma. So asthma in Maryland is in some of the highest rates in the entire country. And okay, yeah, we're not okay with that. Oops, I'm a little bit out of order with my. So, if you look at this, is a map of where the asthma rates in the state are the highest. In fact, not the asthma rates. These are the emergencies. These are the emergency department visits caused by asthma. And when children are most severely affected, and African American children especially have far higher rates of emergency department visits than everyone else. And they miss school. It means their parents need to stay home with them. Their health suffers, their education suffers, productivity suffers. Everyone really has a hard time with that. And let's look at what's driving this. So in Baltimore, we're looking at, of course, there are cars, but there are cars in DC too, and they're not looking at rates like this. All of those are power plants. We have a high concentration of oil, coal, and natural gas power plants. And there was also approved, one of the largest new garbage incinerators in the country got approved for one of the poorest neighborhoods in Baltimore City, in Curtis Bay. And they kind of, I don't know if they pulled the wool over somebody's eyes because it wasn't put in as an incinerator. It was put in as a renewable green energy power plant. But the pollution that it spews out is driving these kinds of asthma emergencies. And we have a habit of placing huge polluters in poor neighborhoods. This is a phenomenon nationwide, and it's very present here in Maryland. And the Maryland Environmental Health Network is here, and they'll be talking about something that they call cumulative impacts, that we need to say no more polluters in this neighborhood, because if you have, if you're just looking at the permit to get the polluter in, they might meet all the requirements, but they're not taking into consideration that there are already 20 big pollution sources in that area. But you may have noticed there was another part of the map that was red also. Do we have a bunch of coal-fired power plants out on the lower eastern shore? I don't think so. What we have is their biggest industry and biggest job creator is sending them to the emergency room. The poultry industry is spewing out ammonia, dust, and volatile organic compounds. That's what that is. Like poop made into dust. It's in the air, right? Not good for you. And there are ways to mitigate this pollution, and there are ways to create economic growth that does not send us to the emergency room and that does not hurt our health. And we're going to be talking about that today. So let me go back and show you also what's happening with our unemployment rates. This might be a little bit hard to see, but what we're looking at is unemployment, of course, is unevenly distributed across the state. And while we have the highest numbers of people in poverty in Baltimore City, our unemployment rates are actually the highest in Western Maryland and the lower Eastern Shore. Those areas are really suffering. And in fact, the racial disparities are very significant there as well. We have a staggering 18 and 19% unemployment rate among African Americans in those rural areas. So as we think about how our economy grows, we need to make sure that the economy is growing and making our quality of life better. At last year's legislative preview, we went into depth talking about the Genuine Progress Indicator. You can Google this online, Genuine Progress Indicator Maryland, and I'm really pleased that Maryland is one of the few states, one of the leading states, the first state, to be tracking a kind of a triple bottom line in our economic data. So this looks at environmental, social, and economic impact. So the red line is our gross state product, which is basically the same. You're familiar with GDP. This is the state level GSP. And as you can see, our gross state product is doing pretty darn well. It's been chugging along and growing fast. But as the years went on, the gap between the gross state product and the Genuine Progress Indicator has widened. And we have seen that back in the 1960s, those two were really close. So what is driving that? Rising inequality, environmental degradation, higher commute times, all of those things are degrading our quality of life and increasing the gap between our economic productivity and how we actually feel every day. So when we think about those polluting industries, let's try to think about ways that we can grow our economy and create jobs in a way that's environmentally sustainable and healthy for the people living here. So again, talking about that triple bottom line. So what are we going to do about it? I love working in the nonprofit sector. I have worked in the nonprofit sector my entire career, and I'm so committed to our kinds of organizations who I think really hold the solutions to all of the kinds of problems and gaps that I have described. Maryland Nonprofits is going to be celebrating our 25th anniversary next year. And we have been committed to strengthening the capacity of nonprofit organizations to achieve their missions. And we have been fighting the good fight in Annapolis in public policy to make Maryland a better place to live. We're going to be doing more of that now. With our Quality of Life initiative, we want to serve as a catalyst, a convener, and a connector to help all of you connect your important mission work to a bigger vision that we're all working towards for a better future for Maryland. And we actually have the power to do this. We have the heft So we are paying out $13 billion in wages in Maryland. That's 10% of the workforce in Maryland, or more than 250,000 employees working for nonprofits in Maryland. That's not to mention the thousands of nonprofits that are all volunteer-led, and we're mobilizing hundreds and hundreds of thousands of volunteers. I think it's over 1 million. I think it's in my speech that you'll be able to get online. The total number of volunteers, but it's big. Suita knows. She'll come up. It's here. Anyway, Suita, thanks. I'm gonna pull that number of volunteers.
I just know the region was 3.4 million.
Okay, 3.4 million volunteers in the region. That includes DC and so we really believe that the solutions include all three sectors, and that the nonprofit sector plays a very unique, nonpartisan, non-biased, but very powerful and important leadership and connecting role, bringing the three sectors together for a better Maryland. And we have found three distinct strategies that nonprofits are using to make this kind of difference. So the first is around creating interconnected communities, where we're recognizing that environmental sustainability and how a community thrives and connects to each other can actually build the economy and grow jobs as well. We're seeing collective resources for collective action, where organizations are pulling together funds and office space and other kinds of resources to all work on similar problems together. And we're seeing transformative leadership in uncertain times, where leaders are willing to challenge the status quo, where they're willing to roll up their sleeves, build trust, do what it takes to move the needle on some indicators that have been intractable over time. One example of creating thriving interconnected communities is the Eastern Shore Land Conservancy. They created in Easton, which is one of the cities that in the entire country is number 3 for being vulnerability to rising sea levels due to climate change. In Easton, they created a multi-tenant center, the Eastern Shore Conservation Center, that houses 5 nonprofits under one roof, all committed to creating a sustainable environment. They placed this center in between 2 of the poorest parts of the city as a hub for revitalization. And they're promoting the development of parks and trails and affordable housing and other things that can really help revitalize the town of Easton and improve the economy. That's triple bottom line results. They also have a project in Cambridge, Maryland, where they're taking a World War II packing plant, and that, manufacturing had really left Cambridge and left a lot of poverty behind. Poverty itself started to become an industry there. And they've connected with local farmers and the General Assembly, who's helping with putting in housing, replacing rental units with opportunities for home ownership for the workers there, and again, connecting with parks and trails and a whole revitalization of Cambridge's manufacturing base. That's triple bottom line success. When we look at collective resources, I'd like to share an example of the United Way of Calvert County. I think many of you have been working on the issue of obesity. We know that sugary drinks and all that time spent commuting and lack of access to healthy food and not having time to prepare it, and so many other issues are leading to record high obesity rates. In Maryland, it's 36%. More than 1 in 3 of us are facing obesity. And in Calvert County, it was a gut-busting 73%. They had the highest obesity rate in the state. And so the United Way said, all right, well, that's what we're going to work on. And as you know, they've been in the business of collective resources for some time, raising money from private sources and helping nonprofits through grants and through helping focus on outcomes, which many of us really resisted and had a hard time with for a long time, but we had to admit, yes, we really do need to work on outcomes. And as they had already plowed the ground to make that possible, nonprofits and others in the community, including the Chamber of Commerce came together with a strategic plan to reduce obesity, and happy to say that they succeeded in bringing the rate down by 11% in their efforts, which is really tremendous. The Governor's Office on Service and Volunteerism has been trying to create collective resources for us by increasing the number of AmeriCorps volunteers available to our organizations and the Chesapeake Bay Conservation Corps. In a visit to the Governor's Office, we met a gentleman named Kenny Ebron, who is who founded Biggie's Community Center in Rosemont neighborhood, which is just a few blocks from where Freddie Gray called home. And that community center, Kenny, was funding it with his own money to try to create some activities for the kids and for the community members in the neighborhood that he loves so much. And he hooked up with the Governor's Office on Service and Volunteerism, who helped him leverage business investment and really get things going to have a community garden and GED classes and a real vibrant hub for that community that was so in need. So we really are seeing some triple bottom line results. We also have Baltimore's Promise, which is a classical, I say classical because now it's a state-of-the-art collective impact project that is bringing together funders and institutes of higher education, the school system and local government to create cradle-to-career readiness for Baltimore's youth and really try to get at the data and the metrics that will drive the kind of action that will make a difference in Baltimore's education system. So I'd also like to talk a little bit about transformative leadership in uncertain times. And this is where, in some ways, we're looking at ourselves. So how long, we sometimes ask ourselves, will nonprofits have to be in the business of meeting basic needs? So are we really working to break the cycle of poverty, or in some ways are we even reinforcing it? Nonprofits are asking these very critical questions, both locally and nationally, as the, quote, charity model is being brought under scrutiny, and people are really asking, can we do things differently? You know, we know the old proverb that if you teach a man to fish, you feed him for a day, or sorry, if you give a man a fish, you feed him for a day, but if you teach a man to fish, you feed him for a lifetime. Well, in a way, that proverb sort of breaks down if the fish have been poisoned by toxic waters and the lakes are drying up because of the drought, and other kinds of issues in the environment are not making it possible for people to even use the skills they have or have any access to the equipment. So both metaphorically and literally, nonprofits are working on those issues. And I'd like to share the example of Rosa Linares, who is a farmer originally from El Salvador, who lives in the Tacoma Park, Langley area, which is on the border between Montgomery and Prince George's counties. The Crossroads Community Food Network has set up a farmer's market there that was just at first a kind of a pop-up farmer's market. They serve people, they had people coming speaking 6 different languages and selling fruits and vegetables. And now it's really grown into a whole community reinvestment program. They have a micro-enterprise food program. They have a partnership with the health department that used to just be sort of catching people who might be violating the regulations. And now the health department is a real trusted partner, providing training and resources for people who are supporting their families by providing excellent local healthy food for people in their communities. So that's the real triple bottom line success. That's the real transformative leadership that we need to see in our communities. So how do we achieve this Maryland dream that we all want? So when we think about a Maryland dream where you have transit that allows you to have time with your family, more jobs closer to where you live, schools that prepare our workforce for new industries, infrastructure that supports growing businesses, wages that rise across all levels of income, clean water and clean air that allow for our children and wildlife to thrive. Let's work together to create this Maryland dream. Let's find ways to have interconnected communities, collective resources, and transformative leadership so that we can have the Maryland that we all want. Our call to action, and Henry's going to talk more about our public policy priorities, but we really need to restore those budget cuts that we all painfully lived through because of the recession. It's time to bring back the funding for these programs that, for example, really, I mean, I don't need to tell you guys, you help someone who's a returning citizen get a job and have mental health services and have substance abuse services and get on his or her feet. They're going to be supporting their family, paying their taxes, contributing to the community. You don't help them, they're going to be back on the street, adjudicated, in jail. You do the math, you know? So the amount of money that we spend on the help is so much smaller than the amount of money the state would spend without the help. Yet those are the programs that get cut. It blows my mind how small our investment is in workforce development. We need to make sure that we're investing in those transit options. You saw that heart attack map. We need to make sure our government is transparent and accountable, and for crying out loud, it's time to reform that procurement process, and I think Henry's going to talk more about that. But we really can afford, we're the richest state in the nation, we're the richest nation in the world. It's not a matter of can we or can't we, it's a matter of will we. Do we have the will to make the choice to make the Maryland dream possible for everyone in our communities? I believe we can. Together we can. Thank you very much.